The risk of children being orphaned per COVID-19 death is highest in the poorest countries and those where people of reproductive age have the highest rates of non-communicable diseases, according to a new study published this week in the open-access journal PLOS Global Public Health by Callum Lowe. In this study, the researchers used a previously developed COVID-19 orphanhood calculator to predict the total orphans per COVID-19 death for 139 countries. The team found that the risk of orphaned children, those who have lost at least one of their parents or caregivers, was much higher in countries below median GDP per capita, 1.56 orphans per COVID-19 death, compared to countries above median GDP, 0.09 orphans per death. The increased risk of orphans was specifically associated with greater poverty prevalence, B equals 2.32, p0.01, lower GDP per capita, B equals -0.23, p0.05, and a higher proportion of people with non-communicative diseases who are between the ages of 15 and 49, B equals 1.46, p0.0001. In almost all global regions, it was also associated with lower vaccination coverage. The authors conclude that due to pre-existing health and vaccine coverage inequity, more children will suffer the loss of their parents due to COVID-19 in poorer countries. Inequity in access to COVID-19 vaccines will bolster this issue further. Make a difference. Sponsored Opportunity StorySource, materials provided by PLOS. Note: content may be edited for style and length. Journal reference: Callum Lowe, Lely Rakhmawati, Alice Richardson, Matthew Kelly. COVID-19 Orphans, Global Patterns Associated with the Hidden Pandemic. PLOS Global Public Health, 2022. 2.8, E0000317, doi. 10. 1371, Journal. PGPH. 0000317. Cite this page, PLOS. Risk of children orphaned from COVID-19 highest in poorest countries. In poorest countries, each COVID-19 death estimated to result in 1.56 orphans, versus 0.09 orphans in high GDP countries. Science Daily. Science Daily, 31 August 2022. ift.tt/ezherguln. PLOS. 2022, August 31. Risk of children orphaned from COVID-19 highest in poorest countries. In poorest countries, each COVID-19 death estimated to result in 1.56 orphans, versus 0.09 orphans in high GDP countries. Science Daily. Retrieved August 31, 2022 from ift.tt/ezherguln. PLOS. Risk of children orphaned from COVID-19 highest in poorest countries. In poorest countries, each COVID-19 death estimated to result in 1.56 orphans, versus 0.09 orphans in high GDP countries. Science Daily. https://ift.tt/ejrgvln, accessed August 31, 2022. Thanks for watching. Please subscribe my channel for more videos.